spectrum colored glasses. Who am I? Dr. Nico DePaz, mother of sons on the autism spectrum, PhD, BCBA, owner of a private practice supporting families of children with autism. Why am I here? To share my story in hopes that it can make someone's life just a little better. Today's topic, communication. So when you talk about communication, or when I talk about communication and teaching communication to my clients, and for future reference, clients, I call them children. I feel like all of the children, individuals that I help, that we teach, they're our babies, they're our children. So when we teach our children communication, there's two forms of communication that we target. We target receptive communication, and that is when you can hear what someone is saying, understand what they're saying, and then either respond by doing an action or following directions or something like that. But then there's expressive communication. Expressive communication can be done vocally, using their words, talking, speaking. Expressive communication can also be done non-verbally by maybe touching a picture, showing you things that they want, or taking your hand and moving you to the item or bringing the item to you. So there's many forms of communication. It's not just one, which is talking. And I say that because I learned, as I have been mothering my son on the spectrum, who is now 19, I learned through a speech therapist a few years ago that there is something called forced communication. And he actually sent me some literature about that. And it was a research study which interviewed individuals, adults with autism, who talked about when they were children, they experienced forced communication, but forced verbal communication. And that wasn't their most comfortable form of communication. And some of the things that I read was that the the difficulty in taking the thoughts, the words, and then forming them, the mechanics of actually forming the words, the sounds, the way you move your lips, the position of your tongue, the way you put air out. Like all of those things have to work together to get the sound, to get the words to come out. However, there's so much that is happening in here. So much that's happening in here. So when he said that to me, we started doing things differently with my son. When he started his counseling sessions, I would tell his therapist to use the chat window because he was doing it online. So I said, if he does not verbally or vocally speak to you, then you can speak to him and tell him that, you know what, you don't have to vocally respond, you can type. And when she did that, they started having conversations. They started going back and forth, and she was actually able to communicate with him. And so then I did it as well. I sent him a message. We just created a Google Doc, and I would type something. Could be either like "Good morning," and then he would respond like, "Hey, what do you want?" And we would go back and forth. And through that, I learned that he is funny. He has a sense of humor. That his spelling and his diction is off the charts. And he knows how to use words in such a way for emphasis. Like if he wants to say something strongly, he puts all caps. He even changes font sizes when he wants to really say something strongly. He uses bold, he uses italics, and it just, just that's our interactions, okay? So then I recently came across a thread that he had posted in Reddit, and he created his own screen name that has no connection to his real name, which is great for him. But he was talking about a particular cartoon. But here's what's brilliant about it. He was comparing and contrasting the antagonist of the cartoon, right? And their transition from being a protagonist to an antagonist, and how much or how he felt about that transition. And then after he talked about that, he did a comparison with another cartoon and that protagonist, and how that protagonist turned into an antagonist or villain, and what happened. And he was funny about it. He he would say, I can't even remember everything, and I don't want to read it because that'll sort of take me out of what I'm trying to explain. But here's the thing. Communication comes in so many forms. Please don't take for granted what your child understands, because there is so much that they understand. They may not be looking directly at you, but they're paying attention. They may not be able to form words, but they have something to say. So that is something that I'm learning from him. And because of that, that carries over into my practice. And I recognize when children, maybe they can't say the word blue, but they know if I ask them to find blue, they can find it because they understand what I'm saying, right? What do I want you to take from today's topic? I want you to understand how our babies, our children, how individuals with autism are sometimes, a lot of times, underestimated for their intelligence and for what is happening inside their minds. And what is showing on the outside sometimes does not match with what's showing on the inside. So what am I saying? Don't write them off. Don't assume, and don't think of them less than. Find a way to communicate. Find a way to get inside. But in order to do that, you also have to believe that there is something inside. So that is our topic for today. See you next time.